All right, everybody, welcome back to the Mission Roll Call Town Hall. I'm going to be your host today, Ray Whitaker. It's great to have you guys. I hope you guys had a wonderful 4th of July for those that are out there. I got to spend a little bit of time with family and friends and obviously celebrating 250 years of the United States. So what an amazing opportunity to kind of just be around folks and be able to hang out. Today, like any other time, we're going to have a really good town hall. We got a lot to talk about. We also have a guest today. Jim will not be here today. He decided to take a little bit of time off. We try to disapprove it, but unfortunately, he's the boss. So he gets to decide. And so he's on PTO this week. You guys will see him back for the next town hall, which is going to be happening on July 22nd at 12 p.m. Eastern Standard Time. So we're looking forward to having him back. A lot of stuff to put out to you guys and everything else. Barry, good morning to you, buddy. Hope you're doing well, man. How was your 4th of July? Hope you had a good one. Mark, good to see you, brother. Hope you're doing well. How was your 4th? Yeah, you guys let me know how your 4th of July was, man. I'm interested to see how it went. Okay, so today we got a special guest on. I'm unbelievably ecstatic about the person that you guys are going to get to meet today. You guys have met her before on a different thing, but Michelle Lang. So I don't want to say too much about her and what her organization does, but I'm telling you right now, we like her so much that we're like all in on supporting her and making sure that she can impact veterans across the country. So it's unbelievable. LinkedIn user, good to see you, buddy. Good afternoon. Hope you're doing well. Roger, how are you? Good to see you. Sandra, hope you guys are well. Okay, so our monthly survey is live. Look, this month's survey is probably one of the most important surveys that we're going to ask you guys to take. Okay, there's a lot of surveys that we've asked you guys to take, and you can see it like it's over here. So right there, that QR code, we need you guys to go and take it. This is probably 10 minutes of your time that you're going to be able to go and take this thing. But Take Care of America's Veteran Act is where our questions are this time. Okay. There's a lot of stuff that's on the internet about this, a lot of social stuff. We want to get directly from you, your voices. As you know, everything that we try to do inside of this organization is based off your voice, right? You guys lead the charge as veterans and family members. So if you guys could take just a few minutes, please go take that. There's never been a more important time for you guys to go and take that and get your voices heard. Okay. Leah, good to see you. Hope you're doing well. Jason, good to see you as well. So if you guys take it, that'd be great. Our next monthly town halls, we talked about a few seconds ago, to be July 22nd at 12 p.m. Eastern Standard Time. We expect that one to go off with no hitch. During this town hall, if you have any questions, no matter what platform you're on, you can be on TikTok, on wherever we are. I know we're on a lot of them. Like I'm just here. I'm just a pretty face here. That's all I do. But if there's any questions that you have, please post it up. If we don't have the answer right now, don't worry about it. We'll reply back to you guys later. You guys can also contact us directly through the website. We'll be more than happy to reach out to you guys and answer your questions. All right, first and foremost, some of the administrative stuff we want to talk about. We talk about this every week. We want to talk about our 2026 limited edition shirts. Part of the reason that we do these shirts is because the importance, right? So bringing up veteran issues and talking about veteran issues is what we're about here in Mission Roll Call. This year, through our limited edition shirts, we focused on 2 kind of different shirts. One that's still here, and then one that you matter. The still here is for the veterans that want to say like, hey man, I lived through it, right? I battled through it. I've done my time and I've chose to still be here and still be part of this thing that we call life. Okay. And there's a lot of us out there that have done that. On the back of these shirts, we have fingerprint. As everybody knows, as human beings, fingerprints are our identity. It's what we are as humans. And inside of that, we've got some sayings and stuff. We got some great stuff that the staff put together that's all about why this shirt exists. Let's say you didn't serve, right? You have the other shirt, which is you matter. So I know for my family, they're always very thankful for my service and the time that I put in. This gives you an opportunity to have something that looks very similar, but instead the dog tag, you've got you matter. And on the back, you also have a fingerprint with some sayings. If you guys get a little bit of time, you want to support the organization, you want to show your support for veterans wherever they are, we'd ask you guys to go check out the link and get yourself a shirt. Leah, thank you so much for getting one. I'm glad that you like it. I was going to buy a medium, but I didn't think it would fit that well. And then your husband would make fun of me is probably what would happen. All right. So next we got Operation Recap. So, wow. June was we had a lot of stuff going on in June. Okay. So there's a lot of stuff that has happened through June, and you'll see on there as you guys go through the page and kind of look at it. Sean, awesome, brother. Thanks for getting your shirt, man. Thank you for getting that, by the way. We have a lot of stuff that's happened. Jim's had a lot of opportunities to do stuff on his side. Mike has done a lot on his side. We've got the entire team has been moving forward with the website, stuff like that. A lot of the surveys that we've had. That's what that operation recap is. It's a great opportunity for you guys to look at all the things that we have going on as an organization. So I'm going to post a link up here. They tell me not to do that, but I'm still going to do it anyway. You guys, whatever platform you're on, the staff will post this link up also so that you guys can go and read through it. Look at all the different things. A lot of these are stories about you guys. It's stories about veterans. It's stories about their families. It's stories about things that are happening real time today. The point of this is to make change. You got to have stories, right? We've got to hear these stories directly from you so that the folks that are making decisions can see those stories and they ensure that they're positively impacting you. So we appreciate you guys so much for giving your stories. We're going to continue to do that and continue to put in. If you have an interesting story and you want to tell it, reach out to us. You guys can go to the contact us page on the MRC website, fill that thing out. Let us know that, hey, I'd love to tell my story, or I know somebody else that I think you would love your story. Invite them in. We'd love to do it. But this right here, you guys can QR code right there. There it is. Even guys after the fact that watch us on YouTube, you guys can still use that QR code to do that stuff. All right, next, let's talk the honor wall. We're getting closer to Veterans Day. I mean, we've got a couple months left, but one of the things that we try to do, we really want to focus on as we get through probably around September, we start talking about veterans. We start posting stuff up a lot on our social accounts. Here inside Mission Roll Call, Veterans Day is every day, right? Almost all VSOs, veteran service organizations, and nonprofit are exact same way. We want to be talking about you as much as possible. We don't want anybody to forget, right? So what we would ask you guys to do, if you look right there, you can see it says add your hero. You have an opportunity to go and submit somebody that you want us to make sure that we're talking about this year. Okay. We just got this feature added back up. We had another feature last year. The amazing team here put this together for you guys. So we'd ask you guys, take a little bit of time, visit the honor wall here. Let me post this up real quick. And you can also QR code it right here, but you guys can go and submit somebody. It could be your grandpa, it could be your dad, it could be your mom, like it can be whoever it is, somebody that's served. Take a little bit of time. They could still be serving also. Okay, they're going to be veterans one day. So we definitely want to hear a little bit about them and everything else. All right, what we want to do real quick is I want to talk about the Veteran Resource Directory, but the best way to talk about it is just to let a video play. So let's let Nate do that real quick.
Support for this program is provided in part by the Veteran Resource Directory, connecting veterans and their families to trusted services and support across the country. From housing to healthcare and beyond, the VRD makes it easier to find help when and where it's needed most. For information, visit missionrollcall.org.
Man, we're getting good at this. We're getting so good. We even got videos coming in. That's great. So we thank Nate for putting that together. So the Veteran Resource Directory is for veterans, right? Also for their families. This thing's going to continue to expand and continue to get bigger and bigger as time goes on. The whole point here, the QR code right there, the whole point here is to make sure that you have what you need to be successful wherever you are in life. Doesn't matter if you're transitioning, doesn't matter if it's after the fact. A lot of these are partner organizations and sponsor organizations that we have, we've gone through, we looked at what they're doing. We looked at reviews, we talked to veterans, and they've told us like, hey, these are the organizations that we're using that are making an unbelievable impact for us as an organization. That's who's on the VRD. We're not just like throwing random VSOs on there. We're looking for VSOs that are doing their part to impact you guys locally. If we're missing a VSO or an MPO that locally that you've seen out doing great work, please submit it. When you go to that page, you'll see that there's an actual location there that you can submit a resource, or you can even send it to them and have them submit as well. We'll reach out to them. We'll talk to them. We have a phenomenal team. Jason is the lead of that to make sure that we're bringing in the best VSOs. We're thankful for all the time and work that he does to make sure that we're bringing the best folks in. And he surprises us every week, man, because we got somebody just unbelievable comes in. Examples like All Vets. We had an opportunity to talk to them a couple weeks ago, and unbelievable, right? So if you know other folks, please bring them into the thing. All right, the thing that we're really excited about, we got a lot of these happening this year, is the MPO symposiums. Right. So one of the things that we really want from Mission Roll Call and all of our partners, all the folks that we've kind of teamed up with, is we want this idea that this is a team effort. No one nonprofit is going to be able to support all veterans. Okay. There's the QR right there. So we have our 2026 MPO symposium page that kind of lists out what's coming. Our next event is going to be in Gettysburg, Pennsylvania. It's coming up here towards the end of the month. The interesting part is that the guest for today, we're actually teaming up with her and we're kind of following her along with some of her events, and we have our own that are happening. But the whole idea is she's got veteran community events where it's veterans and their families are coming out. It's unbelievable. And I want her to talk about, I don't want to butcher it because the amount of work we had an opportunity to attend some, and it's just like unbelievable. You have that happening on one. And then also we're bringing the MPOs and VSOs in to talk about analytics, data, and information that impacts at the local level. Okay. We want to come in, want to give you the best amount of information possible to make sure that you can advocate appropriately for the veterans that are there in your local community. And then also have real conversations. Meet people that are in your community that you don't even know are there, that are out actively impacting veterans. We want to make sure that you guys are, giving each other names and email addresses and phone numbers so you can be connecting, right? The power of connection, the power of teamwork is unbelievable in this day and age. And we want to make sure that it's happening all the way across the lowest level. Nathaniel says, bringing vets together is always an honorable cause. It is. You know why? Because we need each other, right? So doing it, I'm humbled to even be part of this organization, and I know that our entire team loves it. So we appreciate you guys being there. Michelle Lang is awesome. We can't wait to have her on here in just a minute. Okay, so if you guys are interested, you can go to they'll put up the QR code here again in a second. You guys can go to the event that's happening. The other part of it is the 25th. Michelle Lang is going to have her event that's happening also in Gettysburg. So you've got 2 really good days of really impactful events that are coming, and we're just starting. Okay, we're going to keep growing this and making it better, and we are just overly thrilled to have what today's special guest is going to be Michelle Lang. I've had an opportunity to meet Michelle, had an opportunity to meet her husband. We went to an event that was happening here in North Carolina. I didn't know what to expect. We've had an unbelievable relationship with her, I think almost over a year now. We got to listen to her story. We got to watch her, her LinkedIn post. We got to watch how focused she is on impacting veterans at the local level. The amount of focus that she puts in to make sure that veterans in rural America are getting what they need to be successful. So she is focused on bringing attention to those groups. I took a little piece so I didn't butcher this up for her and what her organization does. It was interesting being at the event, and then you read this and you go, man, there's so much more that the organization does than really what's captured here. But what Operation Honor Rural Salute, which is the organization that Michelle leads, is focused on bringing the resources, the relationships, and real solutions directly to veterans where they live, work, and quietly struggle. If you've not had an opportunity to go out to rural America, man, it's different. Right. It's a different area. Neighbors know neighbors. You don't have 1,000 stores everywhere. Right. Like it's a unique thing. So if you live closer to a big city, and you want to go to the VA, or you want to, you're looking for food, like all these things that we don't think about because we're closer to this. Right. I'm 35, 40 minutes away from what I would call a larger city. You don't think about that. And when you get to rural America and you understand that some of the veterans and families, they don't have that. They don't have a VA that's, even an hour, 2, 3 hours away from where they are. Right. It really starts to bring up a uniqueness. And that's why we really appreciate everything that Michelle and her team's doing. So we want to bring Michelle in to give her an opportunity to talk a little bit. And if you guys get time, please sign up for the Gettysburg, Pennsylvania event that she's going to be hosting. Michelle, it is absolutely a pleasure. And we're honored to have you today on the town hall. Thank you.
Thanks so much for having me. I always appreciate it. I love talking with Mission Roll Call.
Yeah. Well, we love having you here. Boy, there's a lot to unravel with you and kind of what the organization does. But where we like to start this conversation is like, what got you here? Right. Because there's always kind of a story that brings you to like where you are in your service. We call it service to service because we have this idea where you're just like consistently in the community providing service. What brought you to where you are now in this organization?
As I'm sitting here thinking, I had really great role models growing up nothing military related at all, but and it sounds crazy if you're not from a small town, I had my elementary school gym teacher, who was and still is just this wonderful example of service. She came to my wedding, my sister's weddings. I still use her wedding gift that she gave me. But I mean, she was always out there doing stuff for our community to make our community better. And she was always pouring into the kids and making sure that families were taken care of and they had opportunities and somebody to believe in them.
Mhm.
And I think that's a really, really great example of, besides my family, where
Yeah.
heart for service came from. Because, I grew up in a rural town where my dad and mom, if somebody needed something, they were there. They were there, just getting it done. Dad would drag me along, just get it done, and then we'll move on to the next thing. And you don't need to say thank you. We just did it and moved on. So growing up in a rural community is just really deeply ingrained in you, to have this heart for service. And then you get into the military community, which I had nothing, I had no preconceived notions about.
Yeah.
It just adds another layer, and immediately you see things that need fixed.
Yeah.
And when you come from a place where you're just used to seeing things and fixing things, then you feel like your hands are kind of tied. Um, it makes you really want to try your best to fix them.
Yeah. No, I think the interesting part of what you're saying is, in the military, the biggest thing that we do is we're problem solvers, right? You're looking for a gap, and then and I think most people are used to that, depending on how they grew up, right? Like that's kind of how it is. But I think if you're part of that military culture and you have somebody that's there every day, there's a problem, right? Because your spouse isn't there because they're deployed or this thing. Like you don't have any choice but to figure it out, and you almost become this person that does it. I think Dr. Chan is exactly right. I love hearing that it's somebody from your past in school that you saw as that leader, right? Somebody that was doing this, and you were like, wow, like that's amazing. Like I want to do that as I get, further and further along. So why rural veterans? Like what led to that for you? Is it because that's where you kind of came from, is in a rural environment?
Yeah, I mean, my heart is in rural America, always will be. My family was dairy farmers. My mom grew up on a horse farm. So just being in rural America. But then, when my husband got out of the military the first time, we moved back to, not even, I mean, it wasn't necessarily a super rural area, but we moved back to Pennsylvania. And that's when we were just like smacked in the face with the reality that you don't have community anymore like you did in the military. And it was really hard to find resources. It was really hard to find support. And we had a neighbor who was a Vietnam veteran who was about to be homeless, and his family lived in Maine and Las Vegas, and they didn't know what to do. So we're stuck in our own terrible situation with mental health and having to help our neighbor, prevent him from homelessness. And who do you turn to? And really, we found our greatest support within the veteran community. Um, but I just still thought like it shouldn't be that way. Like there's so many organizations out there to help, and why couldn't we find any of them? So as we started this journey, we started our nonprofit and really wanted to dig in at the local level to get people to understand that there was resources there to support them. But
Yeah.
it goes back to, if you don't know what to ask, then you're never going to get help, because you've got to already know the answer almost to ask for help.
That's right.
And as we were building this organization and listening to more people, we just realized that our hearts all along have been in these rural and small town communities. That's where we've been trying to serve. So we're going to put everything we have into it and do it the right way.
Yeah, no, that's great. Well, I mean, we're going to start with the questions. I love, listen, everybody listening, I love questions from you. I did pass Michelle a couple questions we would talk about, but I told her my hope was that we would get so many questions from you that we would not have to use those. So first off, Stephen, thank you so much. Stephen says, so what is the single most pressing issue rural veterans face daily?
It's hard to narrow it down, to be honest. I mean, I think the glaring one is transportation, and that's if you know about the resources. Like if you know to go to the VA or to utilize these resources, transportation getting there is the number one issue in rural America. Really, though, beyond that is you just don't know what you don't know. There's nobody coming into these small towns saying, "Hey, this is what's available for you." Um, Typically, the people that do come in are equipped with government resources, and that's fine. But there's a ton of other nonprofits out there that can help you with your transmission business, or your education journey, your real estate. There's so many things that are just left out on the table, and nobody is talking to rural veterans, and no one is talking to their spouses about it at all. So there's just a complete barrier to access for these resources in rural America.
Yeah, and I think that's the point for today, is that access.
Mhm.
And I mentioned this at the beginning. I think what I saw, after the hurricane hit North Carolina, I remember not truly understanding how separated rural America was to urban America until we went out, and like that's when it became apparent. Like that was the first time that, I mean, go to the mountains all the time. It's not a big deal, right? Like there's stuff there. And yeah, it takes 45 minutes to get to, small city, not big city, small city that has things. But when something catastrophic happens or something, there is none of that now. That 45 minutes just turned into days to be able to get to somebody that's there. And there is no access in many of these locations because, again, that's what it is. That leads us into this next thing. Michelle, Kevin asked the question, and maybe you can explain this a little bit better than I would be able to. What is the criteria for a rural vet, and what qualifies as rural?
This is a good question, and one that we get a lot, because the definition of rural is a non-definition, I would say. So it's based on the USDA definition of rural. And so there's 3 tiers. And what we consider rural is like, do you have to drive an hour to the VA? Plain and simple. Like, how far do you have to drive to these physical resources? Because we're really not going to get hung up on your population size, or things like that. Like a rural town is 10,000 or less, for like a small town in America. However, there's towns that are larger than that still don't have resources. I mean, food deserts are a real thing with all these Dollar Generals that pop up and then create these all these issues too. So that's why we kind of are intentional in saying rural veterans and small town, because a lot of people don't consider them. It's interesting because, there's that thing where some people don't feel veteran enough and some people don't feel rural enough. So if you live in a small town, like I'm from a small town, people don't think I'm rural, and I have 1,400 people in my small town because I have a main street, right? So,
Wow.
I mean, we're still driving over 2 mountains to get to a VA.
Yeah.
So all that to say is it is pretty loosey-goosey. We go by, do you have to drive an hour to get to the VA, basically?
Okay. Yeah. And oftentimes, even with the VA, even local medical facilities or access to some of these aren't in proximity either. So it's, like even when you think about that, I know because it's hard sometimes, and an hour for somebody also that's rural versus somebody that's in a city, it's hard to compare that. Sometimes you talk to somebody who lives like in Los Angeles, you go, oh man, it takes me an hour to travel, whatever, you know, 5 miles, right? Because the traffic is so dense. But when you really equate how long an hour is when you're driving the whole time, like this isn't stop and go traffic. That's how far the locations are, 40 plus miles away from where you currently live. And they don't have some of the other resources that they have. Food. We talk a lot about food insecurity, scarcity. Like there's a whole bunch of things. We're going to skip around. Sorry, Michelle. But I bring this up because of this idea of access. I didn't understand until I started going down a little bit of a health journey, like just how hard it is for some veterans and to be frank, even military service members in some cases, to get the food that they need on a daily basis. And you just happen to bring up, Dollar General and some of the other stores that kind of pop up all over the place. What is that also part of this access problem? Food insecurity, food sensitivities, and all that kind of stuff.
There still is an access problem with food, yeah. So, I mean, there is, like in Pennsylvania, they have the military share program there where every, I think, second Tuesday of the month, they have bags of groceries that they go and they give veteran families that meet certain qualifications. But there is harder to eat healthier in rural America when your main grocery store is the Dollar General. I will say that. So there's a lot of processed foods. Rural America has the highest chronic disease rate, and it's, I don't want to get like, I don't even think it's political, but there's just these corporations that come in and squash all these mom and pop stores and farmers. And, the USDA is trying to get more farmers enrolled with SNAP so they can accept SNAP benefits. So they are trying to correct this access problem, but it is hard, especially if you don't have, like you're living in town and don't have your little plot of land to grow vegetables or don't know how. Like my dad is a farmer and has a tiny plot of land in town and provides more. I'm a mooch and he provides spaghetti sauce, chili sauce, barbecue sauce, peaches, green beans, beets, onions, all sorts of stuff to
Yeah.
his 4 daughters.
Yeah.
That he all grows from his garden. So if you don't know how to do that and you don't know how to can, which is also kind of getting lost in time,
Yeah.
it is harder to eat healthy. So that's what I've started been doing every Sunday is I post a simple grocery list that you'll be able to shop for in rural America that will make you 3 healthy meals, 1 breakfast, and 1 dessert to treat yourself.
Yeah. Yeah. How do you, man, because there's so many things. I mean, the only reason you bring up food is because it's like one of the essentials, right? Air, food, housing, like these are the essentials as humans that you need to survive. Like this, so to me, it's like, I love that you said that. It's not political. It's just like, it's reality. We need these things to live. Um, how are you guys from your organization impacting right now? Because there's so many things to focus on. What are you focusing on right now from your organizational view across the country? And I know there's a couple different locations you guys go to.
So as we are looking ahead, the 3 things that we're focused on, I'll say 4. Um, is that peer support in rural America. So how can we come alongside organizations that are already there, like your county veteran service officer, and have a peer who also is equipped with resources and host these social gatherings, because there's not as many places to gather in rural America anymore. For coffee or in the evening whenever people get off work. So re-engaging that peer-to-peer network in rural America is on our focus list. Preventative healthcare is a big target, and that is something that I'm really passionate about. How do we ensure that rural veterans and their spouses have the opportunity and the knowledge to prevent that chronic disease? So how do we bring that threshold down and make sure that they're healthy and well equipped? Workforce, making sure that people that want to move to rural America have a job to do so and understand the VA loan. Because there is a ton of workforce programs out there that are doing really, really great work. I kind of want to wrangle everybody and turn their attention to rural America and create more opportunities there. And then the 4th is obviously agriculture. So, the Farmer Veteran Coalition, they do a really great job supporting farmer veterans. There's some other great organizations here in North Carolina. So how can we help them? How can we link arms? And how can we support the farmers that are looking to market their business? There's a couple gaps that we can fill with veteran ag that we're looking to do.
Yeah. And here's the theme, the thing, and this is why we are so supportive of you guys, right? Because, and why we're trying to get all nonprofits to really start to, like, this is a team effort. One organization trying to figure this out it's too much, right? It's a lot of money. It's a lot of time. Like you need a lot, right? what I love about what you guys are doing is what you just talked about. I listened to you a second ago talking about your dad, right? Like he has his farm and he's great. And then you got 4 daughters. Well, imagine, giving veterans an opportunity to learn agriculture that are living in an environment like rural America, giving them the property through the VA loans and some of these other things that they can have to get their own property, and then having them become part of the community where they now can create the tribe, the peer support that they need. We talk tribe a lot here because it's me being able to talk to somebody that I served with is cathartic. There's a lot of opportunity there where I talk to somebody and I'm just like, man, it just always kind of levels me back down. You know what I mean? Like there's just something about that conversation. It doesn't mean my conversation with the others isn't as good. It's just there's something about that. So having somebody that I can have a coffee with or to go with, which obviously your organization's focused on, is impactful. Through those 3 things and what you're doing comes kind of the last thing, which is that preventative healthcare, right? Trying to drop that chronic disease. Each of these, it's the thing I got from your husband when I was talking to him for about an hour. And then I've had opportunity to talk to you. You guys just keep coming with it. And we can visualize it. It's why we jumped on board, because like, man, if more people would do this, and again, you guys are in a couple states right now. Cause again, it's money's king. I wish it wasn't. Right. We're not scared to say it. It is what it is. The only way you can make true impact is I wish everybody would give everybody stuff for free that needs it, but that's just not the way the world works. Right. So as organizations like yourself, how many states are you guys currently supporting, Michelle?
We have 4 state events, but I consult with states all over the United States, in towns. So
if you had more
everywhere,
you had more resources, you had more ability, then you'd be able to do this in more locations. And it's important for everybody to understand. I grew up in Florida. Most people think Florida, it's the beach, cities, everything. No, I actually grew up in the middle of nowhere. My high school, I think graduation class was like 100 people or something, like very small. Like these are rural America is all over the place. It's not just one state or one location. I often think that organizations look at where the highest concentration of veterans are, which they should, but you got to have organizations like yours that are focused on the smaller pockets of veterans and their families to make sure that they are also getting the resources that they require. Because as Suzanne just mentioned here, it's insane to think that persons who signed up to fight and possibly make the ultimate sacrifice may be in danger of starving. We need to do better. And that's what I love most about what your organization is doing is, hey, we're looking at these folks that are a little bit further out that are doing the thing. I want to talk about healthcare, Michelle, because this is something that I think this is where you pulled me in the most. As a veteran, I know I've had my own healthcare things just in general. And it's why, because, you wake up every morning, do physical fitness, you start the retirement process. You're like, I'm done. Thank you. I no longer have to do, physical fitness. Right. And then 6 months later, you're like, why does that thing hurt? And well, it's because you're not stretching anymore. You're not running, and all that stuff that we've done to our body over the 20 plus years that I spent is starting to come back to haunt me. And then you add the food, the alcohol, the other things that go on top of that. That is a recipe of bad. I would really love for you to kind of talk about chronic disease and what that means for a rural veteran, because I think not everybody understands the difficulties of and why you guys are focused on that.
Mm-hmm. Yeah. So heart disease, diabetes, these are chronic diseases that can be prevented in rural America, but it's that lack of access of knowledge of healthy food, and sometimes just of convenience, because it is a hard life in rural America in some cases, where you are just working so hard and then you come home and what do you eat? And it's not always the best choices. A lot of times there's both people are working long hours now. And there's going to be a McDonald's in your town. That's pretty much it. And so the healthy options just are not there. And what we've learned is that the VA on average spends about $15,000 plus per year per veteran per chronic condition, treating that. And so what if we could help people have healthier lives and enjoy their lives for longer and not be so, it is miserable being sick. I grew up with a mom who had an invisible illness, and it is not fun watching the person that you love suffer with this with diseases like this, right? So
That's right.
I'm really passionate about making sure that people have good choices, and we want to make sure that people are being taught this information in a way that feels right to them, and we meet them where they're at. Like, I don't ever want this to be a super clinical approach where it feels like we're telling you you're doing something wrong, because that's not it. Your way of life isn't wrong. We just need to make some adjustments in order for you to have a more fulfilled, feeling good life.
Yeah. I think most veterans, I know for me, I wanted to take control, but I just didn't know how, right? Like, and I think you mentioned this at the beginning. It's really hard to find the resources because there's so many like, I don't know, like, who do I go to? Right. And then when you amplify that and you put that in a rural setting where the resources aren't even in my area, they're, whatever, hours and hours away from me. And I'm getting sent to a website that I got to hit the contact us, or I call in and nobody's answer. Like all it, I was bred not to quit. So it's hard to quit. But even for me, there started to become points where I'm like, man, I'm just going to give up, man. This is, so I can only imagine other folks and that path that they take to get there. Timothy noted here, Michelle, in our area, we had a lady with an idea on having others eat healthy and direct from the farm. She created farm to porch and made an email sign up. Well, after a few weeks, she's over 30K in sales to farmers and healthy businesses, i.e. soaps. Super helpful for us who may not know the farmers, but want clean food. Yeah. I mean, and I think that's what you guys believe in, right, Michelle, is this idea of community. Like, that's that's the baseline. So another question I have for you, what programs are available? So for the veterans that may be listening that live in these rural areas, what programs are available for them to, like, start their own business? Like we were talking about here, their own farm, their own agriculture. Is there something out there that you know about for folks?
Yeah, every state or let's back up. There's VBOX, Veteran Business Outreach Center. So if your state doesn't have one, there is a state that covers that territory, and it's through the Small Business Association. So I use it personally down here in Fayetteville, and it's a really great resource. I'm lucky enough that I can drive into Fayetteville to my VBOC, meet with a counselor, have a workspace. I can rent out a conference room. It's all free. And gosh, they have so much that you can print for free. You can 3D print for free, all this stuff. If you want to start a business, I would say that is the best place to go. Look up the VBOC in your state, VBOC, and give them a call. Now they do things virtually as well. So if you are like 6 hours away from one, you can still utilize it. Really, really great resource. There's also other resources, like I also use Victor and Valor, who helps me with my nonprofit. They help my marketing and branding, website, everything like that. There's, if you want to buy your own business, say you want to buy an existing business that the owner's selling, like an HVAC business. There's Owners in Honor that will work with you to help you do that. They want to help keep Main Street alive, and they believe that military members, veterans, military spouses are fantastic entrepreneurs. I also agree. So they will help you through that process. And there's also organizations like Veteran Service Brands, who you can buy a franchise from for very inexpensive. And their franchise opportunities are great for rural America. It's like painting parking lot lines. What is another one? That's the only one I can think of. But they're very trade-oriented franchising opportunities.
Yeah.
So it just kind of fits in naturally in rural America. So there's a ton of opportunities.
Yeah. And I think that's the hard part. And I think you guys are trying to work on this and I think you mentioned like the service officer. Correct me when I'm wrong, because I probably will be, Michelle. That happens a lot for me. But you'd mentioned like the local service officers, trying to work with them and then figure out how do I get the resource? Because that's always the hard part, right? Me as a veteran, I live rural area. And by the way, I don't have high-speed internet. This is also something that most people don't understand, right? The further you get away from cities, the harder it is to get, what we would call acceptable internet connection, things like that, right? It's not high speed, it's not 1 gig, stuff like that. You're gonna, you're gonna have stuff that's like 100 megs. So it's just enough to search, but it takes time. So somebody's not on the internet a lot, and some don't have internet at all. So they're just using phones and stuff like that. But I think you're trying to work with service officer, and I love for you to kind of talk about that portion you talked about, like trying to get the resources a little bit better, make that connection a little bit closer, and then impact that community.
Yeah, so there's county veteran service officers, and a lot of the counties do have them. It's state dependent, and many counties do have them. But then there's some states, like as you go Midwest, where there might be a county veteran service officer for like 6 counties. So it gets really, really tough in that central part of the United States where it really is a resource desert there.
Yeah.
But they have all the resources and knowledge that the state has. So it's the State Department of Veteran and Military Affairs. They work closely with the county veteran service officers, and that's great. But then you kind of only know like your local nonprofits that are operating in that area. Whereas like here in Fort Bragg, we know that there's a ton of nonprofits that can serve everywhere in the United States, but are not reaching those rural areas and those county veteran service officers that could have that as an option to give to their client that comes in.
Yeah. And I think, we started this, we started this conversation when you and I were in the green room. We were talking about the organizations that are out there. You've got the VFWs, the American Legions, the DAVs, the Wounded Warrior Project. There's just a lot of organizations that have, and it's part of the reason that some of these organizations were created. They have an opportunity through the connectivity with organizations like yours and others to benefit, that area. But again, it's about creating a team effort and understanding it's not this isn't a ploy. We all have the same mission, and the mission is literally to impact veterans. I want to go to a couple things over here that people wrote in. Michelle's were here. Natasha, I read yours. We do have your email, so we'll reach back out, I promise, today, tomorrow. That way we can have the conversation with you. She said, as Director of Military Affairs on behalf of C3 Pharmaceutical working with Natural Medicine, am I able to request a private conversation with the two parties post video call? Yeah. So we'll get that email and then we'll have a conversation with you. No issues at all. Heather M said McDonald's needs to pay an extra tax that comes from profits it makes off of poor areas that is put back into healthy options for locals. Yeah. I mean, it's hard. We're not gonna get into the political side. I mean, this is a business decision, much of this. I know McDonald's does a lot of good things. They do a lot of good things for kids. Like there's a lot of things that they do. And a lot of organizations do this, not just them. We're a small percentage of that. I don't mean that in a bad way, but we're at 6 to 7% with, veterans, with the entire population of the United States. But I always look at it, if it's happening to 6 to 7%, you then shrink that down to the rural veteran portion that Michelle's focused on. You then have to grow that even bigger again, because now you got to look at the regular population. Because to me, this isn't just a veteran issue. This is also a population issue. We just happen to be lucky and can focus on the veterans because that's where the information we get from Michelle. But the reality is right next to that veteran that's having chronic illnesses is another person that's not a veteran that's having those same chronic illnesses or having the same problem with resources and everything else. So I think this is a population issue that the only way you fix this is we have to stand up. And it's part of the reason Mission Roll Calls here is to get the voice and then send it to the folks that make the decisions. All right. The last person here for us to real quick, Michelle, was Dan. I think peer support and case management is critical to connecting military veterans and families to healthcare and other resources. Unfortunately, these services are limited, especially in rural areas. Any providers tried billing VA Community Care Network to peer support and case management? And that was a question. We're going to try to do it here in Northwest Washington. So have you had an opportunity to see that at all, Michelle, with that question? If anybody's had a chance to build a VA Community Care Network at all?
No, all I can speak to is my rural hospital back home, which is still the whole process. It seems like, as an outsider looking in, talking to the hospital, is they are very confused on the VA billing process, how to get enrolled in as part of that community care network. Because, for example, we have a critical access hospital in our town, which means they are the only I forget what level they are, but they have an ER there. They have a specialty clinic. They have, you know, all these specialty doctors that come in and rotate monthly. We could have our veterans, and multiple counties use that there.
Yeah.
We could have so many veterans go into that hospital, and they do, but they're using their private insurance or Medicare or Medicaid to take care of these issues. They're not enrolled in VA community care. And so there's a lot of confusion, I think, on the civilian side of how to get started.
Yeah.
So I don't have an answer for that, honestly. I just know that it's very confusing.
Yeah. And when you think about it too, like the other facts here, 18 million-ish, we don't know the exact number, 17, 18 million veterans. Half of those don't even have VA healthcare. So I think everybody thinks veterans just get VA healthcare. That's not how it works, right? There's a lot of criteria that goes into who gets it, who doesn't. So that simple math, right? If you just take the 9 mil, 8 mil and 9 mil there and put some of those into rural America, again, it just stacks itself, because now they don't even get VA healthcare. Again, where are they getting the support and everything that they need? And then again, this issue becomes even more complex as you get it. So
yeah, and a lot of our rural hospital systems are closing down. So that's a huge issue right now too.
Yeah. Yeah. I mean, again, it's the like the monopolies of the world. You know, I'm watching it for a lot of different areas. Again, and it makes sense. It may make sense in like a larger city, you know, like all of these, but like the problem is folks don't understand it really impacts the rural communities almost more in many ways than it does these, you know, these larger cities, because, you know, they're feeding off of the folks that are there. And the cost of everything, yeah, cost goes up, but you don't have any more people coming in. Right. So yeah, it costs me more for a bag of this or some of that or some of this, you know, gas, you know, I always say for me, like the gas, okay, well, I just don't go anywhere. Right. I just stay at home, do what I do here on my property. But if somebody's got to go to the VA or something else, man, that cost of gas for them to get there and get home, maybe the tipping point. That may be the thing that I just don't have the money, the needs that I have to be able to even get there. It's hard enough I can eat appropriately, so they don't. So I wanted to talk about that. One of the cool things I saw at your North Carolina, I want to get into now what you're doing locally with your community events. One of the things I really, really liked, I haven't seen this in a long time. I used to love going to these community events and seeing like them taking blood. I used to love going in and just not that you were doing that, but I saw one of those like a school bus medical things that they used to have out there, and I would get inside and they would take blood. But then I remember you talking about you were trying to bring some of this medical to veterans, and I physically saw it at your event. I would love for you to talk about that, Michelle. What's your event altogether, and specifically that with the healthcare?
Yeah, so as we grow it, one of my goals is to bring more screenings to these events. So in North Carolina, we were supposed to have a blood mobile there, but I think they got tied up with another thing. But anyway, blood mobile. We have physical therapy screening, blood pressure screenings. I think we had to cancel the glucose because it was a little bit too hot.
Yeah.
And they said some people pass out. So they canceled
gosh.
that. But yeah, we try and have different screenings there so that way people can get screened for free. In Pennsylvania, we're having free breast cancer screening. So there's going to be a mobile bus that will be there on site doing breast cancer screenings. But you know, we know that military members are exposed to toxic substances. I mean, even whenever we lived in Fort Drum, we got private water reports. We didn't live on Fort Drum. We lived in the city. Our water was outrageously contaminated with lead. And so there's just all these substances that military members are exposed to. And a lot of times it's not getting caught until years down the road, but that's why those screenings are so important. So we really want to make sure that people understand what their baseline levels should be, where they're at, because knowledge is power. And if you don't know, then you think everything's fine until it's not. So yeah, we try and make healthcare as accessible as possible at these events, and just so people get more comfortable going to the doctor and realizing that they're not bad guys. You know, you can have bad interactions with people, but it is still important for you to go.
Yeah. Well, you have to own your own. My dad just told me this, like, you got to own your own decisions and you got to own your own health, right? Nobody else is going to care more about you than yourself. At some point, your family will, that you learn through life, sometimes the easy way or the hard way. But you have to also care. And, it's interesting. I brought my better half came out with us to that event as we were kind of doing our thing. And what I loved about your event was I don't even know how to explain it. It was like acres and acres of just awesomeness. Like that's the best way to put it. I mean, I felt like I talked to so many people there. I had food that I could do. There was animals that I haven't seen animals in quite some time that made me want to go and hang out with the animals. Then I left there. I went over and I talked to an organization that I saw about something completely different. And the next thing you know, I'm throwing, balls at a tank for it. It felt like a place for a bunch of vets and their families to get together, a carnival that I used to be when I was a kid, with being able to find the services that I needed to live a productive life. Like I loved your event when I went to it. Can you talk about, because there's a lot of stuff that happens at your events. Can you talk about all the things that you guys are doing, and specifically the one that's coming up in Pennsylvania, I think on the 25th of July?
Yeah, so I always have a hard time explaining like really what the event is, because you kind of have to be there and experience it. Because I think sometimes just talking about it is like, oh yeah, I get how that might be fun, but it really is like there is a sense of community whenever you're there, because everything happens so organically. So we make sure that the local VA is there. We love to involve the local county veteran service officer, the local VA, the different lines of outreach that can come from that VA. And then we'll grab a regional VA, which we work with the Office of Rural Engagement to bring them in to do enrollment, try and get the National Cemetery in there. So like get all of your VA questions answered. We want you to be equipped with knowledge. And then we bring in all of the resources. So any non-VA resource, whether it's education, employment, other VA benefit, maybe you don't want to use the VA and you want to use a different VA resource, go for it. Health, child education. So like there's really great resources for your military child, things like that. But then there's also your community has amazing veteran crafters. They have veteran and military spouse craft vendors in your community. So we like to bring them out and showcase them, get their products in front of more people. We are starting to add veteran farmers markets. So how can you buy from a veteran farmer?
Yeah.
Or, I mean, in North Carolina, we had an active duty farmer there. What else do we have? Food trucks. So we try and bring in also veteran-owned food trucks. What else do we have? Oh, speakers, kids games, bounce houses, petting zoo is going to be at Pennsylvania again. We usually have live music. So in Pennsylvania, we're going to have live music. In North Carolina, we're going to have a bigger concert next year. So we're doing the same thing, same place, but a bigger concert to end. And then a speaker panel. So we did not get to do that at North Carolina. In Pennsylvania, we are going to have speaker panels. I actually just asked Jason to be on a speaker panel. Like, come on, you're going to come on stage with me.
Yeah.
So we like to, because there's just so many resources, but sometimes you need to hear it from somebody other than the vendor, and you need to hear somebody that lived it. So veteran entrepreneurship, ag, employment, mental health transition, and rural healthcare. So there's a lot of stuff going on. It does stay busy. We make sure the kids are engaged, and we make sure that it feels like a safe and fun environment. So that way, like, parents can come and kind of relax their brains and actually engage with the resources that are there.
Yeah, you don't feel judged either, man. That was like the cool part. I walk around and it's like, it's my people. And I don't mean that like in a, that's not a derogatory sense. It's like, just, I was seeing people that I served with. I'm like, holy crap, you're here. Like, and I've not seen him for, one guy I hadn't seen like 10 years. Like, I'm like, what are you doing here? I mean, it was unbelievable to be walking around, because it's my community, right? Like, that was the important part. It's my community. It's inside of where I am. So what a cool event, because it also did that for me. It reconnected me with at least a handful of people that I had not talked to in a long time. that we just kind of ran into each other. Again, that tribe effort and everything else.
Mhm.
Well, Michelle, we're thankful for you. Ronald had one last question down here, so I'd like to ask this. Maybe you got a little bit of impact here or an answer for this. I have a question. How do we not have better telehealth and mail options for prescriptions? Does the VA not cover remote appointments or mail meds? And I figure you may understand this a little bit better for rural veterans and families.
Yeah, I don't know if something has changed with the mail medication. I think that it has, that he's referring to, because there used to be an option, like I forget what it was called, the script. As far as telehealth, though, from my understanding, they have improved telehealth options, and the rural veterans that I work with that know about telehealth, that's the thing, is like, you got to know about it.
Yeah.
They like their telehealth appointments, but it also is so dependent on your facility. Like, of course, every facility operates differently, right? The standard of operation from place to place is different. So I hear that often where I have, like in Pennsylvania, I have veterans that go to one facility. They're the same distance, a Pennsylvania facility from the West Virginia facility. Well, they prefer to go to this one other facility because the telehealth is better. The doctors talk to them like people. And it's just a different experience. So I don't know if maybe it's that particular facility, but
Mm-hmm. Yeah.
I mean, patient advocate is a huge, and I don't think enough people know about that. If you have not spoken with your patient advocate at your local VA hospital, do that immediately.
Yeah. Yeah. I don't think man, I just tried to think back. I mean, I've said this 100 times and I'll keep saying it every time I get on one of these town halls. Just this idea, it's overwhelming. There's so much information. It's overwhelming, right? Like, it's just, I don't even know how you parse through it. And especially now it's hard to parse through it. And the VA knows that, right? Like, I mean, you go to their website, I mean, it is hard to find what you need and then know if that thing that you're reading will actually impact you the appropriate way. You know what I mean? Because just because you think it's the thing, you start going down that rabbit hole, then it's not the thing. And then you got to start all over. And most people just give up after the second, third, fourth time that they've tried it. They just like, and I know it's even worse for, again, you put the internet, slow internet, all these other things, and it's taken 30 minutes just to get to the answer. You get to the answer. It's not even the right thing. You're just like, you know what, I'm done. Right. Or going into, as we have a map, and I know you've seen, or we talked about this a little bit, Michelle, but we were looking at primary care, how long it takes to get the appointment for that, how long it takes to get the secondary care and all that. And there's different timelines based off where you are. Are you in urban or rural, right? Like, there's completely different timelines associated with that. And then you add in travel distances and all the others. I mean, it could take months for some folks to just get in to see a doctor, right? So that brings the value of what you're talking about. Sometimes all they need to do is do a screening. That's it. Like, all they need is a screening, right? So the ability to come to your event, talk to the VA or get a screening or some of these things that you guys are offering at the community level is just, it's priceless. It's the impact that it has on the individual that's coming out. So we thank you, Michelle. We appreciate the relationship with you. We look forward to seeing you in Pennsylvania. I know the entire team is like all in, like we're sold with you guys and everything that you're doing, because we've seen the impact firsthand. And of course, we have folks that are rural veterans as well. And you consistently are showing up. So we can't thank you enough. I don't think I've met a single person on the internet or in person that doesn't appreciate your organization. So that says a lot about what you guys are doing and just trying to do. For those that are here watching today, we'll put up another link and they'll put up the QR code for you guys to get in contact with Michelle. If you live in a rural area, a veteran lives in a rural area, look, all Michelle's missing to make more of an impact is more money, right? And I mean, sure, we all are. But at the end of the day, there is a lot of people, a lot. Michelle, what's the number of rural veterans? I should have asked you that a long time ago, just approximate.
4.4 million.
There you go. So just imagine that for a second. We said there's about 17, 18 million veterans. 4.4 million of those are rural. So when you think about that, you think about the impact. That's the type of folks that you're going to be impacting. So take a little bit of time, visit her, ask questions, get involved. She's always looking for volunteers and other stuff from an organizational perspective, people in. Anything else, Michelle, from your side that you wanted to say before you take off?
No, I mean, just reach out if you need anything, or if you have any questions. We always ask, how do you vet your resources? And one of the things that we ask is, are you willing to advocate for the veteran that we send to you? Because I don't want somebody to have to be stuck in an endless loop of running around. So our job is to make sure that you're fully seen, supported, and somebody is in your corner. So reach out if you need anything.
Perfect. Well, thank you, Michelle. We appreciate you so much. And we will, I know we're going to be talking to you much more. We'll see you in Pennsylvania here towards the end of this month. So thank you so
Awesome.
much.
Thank you.
All right, everybody. As always, we appreciate you guys coming and hanging out today. I hope you guys got something out of this. We talk about a lot of topics here. It's like every single week, right? We talk about homeless veterans. We're talking about suicide. We're talking about rural veterans. There's a lot of veterans and family members, this 6 to 7% that, that volunteer to make sure that we get to continue to have the freedoms that we have, which we all just celebrated 250 years of that on July 4th. And organizations like, Michelle's and what she's doing from her perspective is unbelievable. And we want to continue to support that and everything else. If anything popped up today, you guys have any questions or anything else, you guys can absolutely contact us. We appreciate you guys. Remember, we'll be back July 22nd. We'll be back in here. Jim will be here for that one. I think I will be I'll be in Pennsylvania prepping for the symposium. And then of course the event with Michelle. But as always, we appreciate you. Thank you for your service to our great nation. And we'll see you guys on the next one. Take care.